For the first time, Minnesota state leaders showing us the timeline of when you want to get a shot, you'll be able to do that.
It starts in April with medically vulnerable people and essential workers. Theo Keith joining us live now. So Theo, go through the timeline for us.
Yeah, we had never seen this ranking before. The governor's new timeline puts people into one of 5 tiers, extending into early summer, though the actual timeline may be weeks faster than that, as I'll explain in just a minute. It starts as soon as 70% of seniors get at least 1 dose, which the governor expects to happen by the end of March. The governor's new timeline puts almost everyone in a priority group. Starting in April, medically vulnerable people and food plant workers will get shots. Then comes a much bigger wave. People with underlying conditions, essential frontline workers like grocery store employees, and people living in multi-generational homes. By May, the governor expects to offer shots to people with less serious underlying conditions, as well as anyone ages 50 to 64. Then the last of the essential workers like construction and IT. That leaves only 300,000 people in the general public by early summer. The timeline is pessimistic. The governor calls it conservative. It does not include any shots from Johnson & Johnson, even though doses should arrive next week. And it includes much smaller increases from Pfizer and Moderna than what those companies are promising.
We're not crafting something that's super conservative so we can step over it. We're crafting it based on the data that's there so we don't get in that situation we got in December where we got overpromised.
For now, seniors still struggle to get shots, especially those ages 65 to 74. Most health systems are still prioritizing 75 and older. Hospital execs say Minnesota's health systems are vaccinating fewer than 8,000 people a day when they could be doing 20,000, if only there were more shots.
We are anxious to get down to 70 to 65, and we think that's going to be happening here in the next couple of weeks as our vaccine supply increases.
Johnson & Johnson is promising to ship 20 million doses nationwide by the end of March. Minnesota's share is 338,000. Health officials say they didn't include them in today's timeline because the FDA hasn't approved J&J's shot yet, though that is expected this weekend.
Right. So, Theo, how will people know it's their turn, and will they have to prove any underlying medical conditions to get that shot?
Well, let me take the when is it your turn question first. You can sign up for the Vaccine Connector. Your workplace might tell you, or watch the news, because this is going to be big news for months to come when a new eligibility group comes online. As for proving your medical conditions, well, health officials say most of these shots are going to be given by clinics and pharmacies. They know their patients. They know if these patients have medical conditions. Health officials today did not seem very concerned about fraud.
All right, Theo, thank you.